Hey everyone, Dr. Brandon Rosie here. Last time I sent out a video about, an introduction about me and really how or why I started to utilize musculoskeletal ultrasound in my physical therapy practice. But what I wanted to talk about today is why or how it is beneficial for using it for our patients, or really any patients rather. And the first one I can think of is that there's no radiation. Contrary to using other imaging modalities that are rather cost effective, such as x rays or radiographs, or even a computerized tomography scan, a CT scan, both of those are going to give you a abundance amount of radiation, whereas an ultrasound scan is not. So compared to the cheaper modalities, this one does not have radiation, where those do. And then with comparison to an MRI or an MRA, those are quite extensively, quite expensive, where the ultrasound is just not that way. It's also going to give you imaging data in real time. The clinician with point of care ultrasound, the clinician is going to be able to diagnose or examine the tissues in real time, as opposed to sending off the order and giving it to a radiologist or a sonographer to perform, or a radiologist technician to perform the scan, and then have a radiologist read it in the future. The clinician is going to be able to perform the imaging right there in the office or in the clinic or wherever they're doing their exam, and then have the data and have the information readily available there. So that's really going to cut down a little bit of your patient's anxiety regarding whatever it is that they're looking at. Um, and also in that, you're going to be able to do what's known as a dynamic test. So unfortunately, with things like an MRI, sometimes, like we've seen, research shows that if a patient has an MRI of their shoulder, maybe the tissue is damaged or there's some partial thickness tears in there, but the MRI doesn't pick it up. And the reason is because those tissues are shortened. As the patient is kind of sitting in that little tube, those tissues aren't going to be on their maximal stretch, and they're not going to be able to assess that the integrity of those tissues, those soft or hard tissue. Whereas with the ultrasound, it's dynamic. We can have the patient in a corresponding position and then have them move, or move them against some sort of resistance, and we'll see how that tissue responds underneath the skin, which is going to be highly valuable to any of the clinicians that are working. Um, I also find that one of the biggest benefits is that to this day, I can't think of a single healthcare field that could not or would not benefit from utilizing some form of ultrasound in their practice. Whether it's for imaging, biopsy placement, placement of needles for performing an intervention, grading for tissue response, or just a response with how any patient is responding to any therapies that are being provided, not just in the physical therapy realm, but others. There is a benefit to that. So, but over the years, ultrasound has changed. 10, 20, 30, 40 years ago, ultrasounds, when they were first seen, and anytime you hear the word ultrasound, you first think of it as it was a dot on a screen. When mothers had their ultrasound scans for their children, or to look to see how their children were doing in vitro or in utero, then those children were, just a couple dots on the screen. The radiologist made an assumption based on how it looked. But now the detail is so incredibly robust and so vast amount of information that is provided, that it really is kind of transforming what the applications are. Back then, they were able to look at just large structures like, oh my gosh, there's a baby there. Now they're able to look at the liver inside the baby that is inside the mother. They're able to look at small vascularities of, each tiny vessel, or nerves, peripheral nerves, tendon insertions. I'm sorry. And then um, really, I've just kind of thought about how this modality has kind of changed over the time, and really where it's going. If you look at any of your corresponding healthcare fields, whether it's an oncologist, a hematologist, orthopedics, dermatologist, radiologist, OBGYN, go on and down through every subspecialty of medicine, there's a place and a time for them to utilize diagnostic ultrasound in their practice. And, as I believe that in any subspecialty of medicine there's almost always a complete or similar corresponding subspecialty of physical therapy, in which case, we as providers would be able to benefit or utilize those services so that our patients could benefit from them as well. So if you have any questions, please feel free to leave a comment down below. I'm going to release another video that's going to talk about where I see the future of ultrasound utilized in PT in the next video. So thank you for watching.